Hi, my name is Meaghan Walsh. I'm currently a senior in the Bachelor's of Social Work program here at Anna Maria College. I'm going to be talking about stress among college students during the COVID-19 pandemic. So to start with the social problem, COVID-19 has been extremely stressful for everybody, but college students are a population that's at particularly high risk because they already experience a lot of stress and there's so many demands on them between work, school, um, social relationships, and other obligations. They are experiencing a lot more stress since COVID. Because of remote learning and just the additional concerns that they might have as a result of the pandemic. Many college students end up neglecting their mental and physical health as a result of this. And colleges are starting to realize this and realize that the impact COVID-19 is having on students, and they're starting to expand and enhance mental health services, which is great. And if students are practicing more self-care and they're given like the time and resources and encouraged to do this by their colleges, they will likely be less stressed and just happier overall. So for background info and identifying gaps, COVID-19, obviously, like I said, is causing a lot of added stress for people. It is important that research includes a diverse population with college students of all ages, because it's not just people coming right out of high school, it's people who have families and full-time jobs and other things as well. It's important that the studies include males, females, and individuals that identify as other genders. And it should also include graduate and undergraduate students so that you're getting the whole sphere of college students. Studies were done a little bit at the beginning of the pandemic, but I haven't seen anything more recently. And now that we're like a year plus into the pandemic, I think more studies need to be done. And I think we should even continue researching as the pandemic continues, and then after the pandemic is over, to really identify the long-term effects that it's had on many different populations, but I'm going to be talking about college students in particular. So my research question was, what is the relationship between COVID-19 and college student stress levels? And my hypothesis was that COVID-19 is related to an increased level of mental stress among college students. So the research design was quantitative, cross-sectional, and I used a primary sample, which I recruited from Anna Maria students. And I did this by distributing surveys through email. My data collection period was from March 8th to April 1st, so it was about 3 weeks. I emailed the survey out originally through Google Forms, and then I asked the research assistant from the college to help me distribute it to the whole student body. So the survey was converted to Qualtrics. So I ended up having a few responses from Google Forms and then more from Qualtrics, and I just combined them together when I was doing my data analysis. And then I received all of the responses back to me after the survey was complete. My sample size was 67 participants. And this was non-probability sampling, which means it was voluntary participation, and participants were recruited via email. I used convenience sampling because it didn't cost me anything and it was the easiest method. The demographics were collected to determine the diversity of the sample that I was surveying. There was some diversity in my population, but future studies could definitely include more diversity. Again, my sample size was 67 participants, which isn't representative of the entire Anna Maria student body or of all colleges as a whole. So I did include all of my results charts here. I'm not going to go through every single thing, but I'll just highlight, I did ask for gender, age, the degree that students are completing, the employment status, since this can sometimes add more stress to people, especially since the pandemic. If they are married, if they have children, this could again cause more struggles for people if they have students at home that are remote schooling and they were having to help with this on top of their own work and school. And then I asked about family history of mental health problems to see if people are susceptible to more stress or other mental health problems. The method of schooling. And then overall stress during the pandemic, I was just asking participants to rate their stress on a scale of basically 1 to 5, so no stress to extremely stressed. Motivation to complete schoolwork. I also asked about that to see how people were handling the remote schooling now that we're back in person. I think for some people it may have gotten a little bit better, but the statistics show that not everybody was feeling less motivated, but a lot of people were. I also asked about if people were having trouble concentrating on schoolwork and difficulty staying in contact with friends. And then I wanted to know if anybody was stressed about finances. I know that was something that a lot of people were struggling with because many part-time jobs that college students might have could be in the restaurant industry or retail or other industries that may have been impacted by COVID a lot. There may have been cut hours or people could have ended up unemployed. So that could be really stressful as well. And then I asked people to explain how often they felt lonely or depressed throughout the pandemic. So for my common findings, one of the most prominent statistics I found was that 78% of participants said they have felt less motivation since the pandemic began in March of 2020. And then 64% of participants said that they have felt stressed, very stressed, or extremely stressed since the pandemic began. And 0% said they felt no stress, which I mean isn't a surprise. I don't think any college student or anybody really ever feels zero stress, but I just wanted to emphasize that here as well. 53% of participants said they've been stressed about finances often or all the time. So that's more than half of the population that I studied is saying that they have been stressed about their finances a lot since the pandemic began. And 53% of participants said they have felt lonely or depressed often or all the time since the pandemic began, which kind of emphasizes the isolation that people are feeling as a result of this. 58% of participants said they've had difficulty staying in contact with friends often or all the time. So again, the pandemic has caused a lot of isolation. There were stay-at-home orders. Schooling was remote. So people weren't seeing their friends as often in person, and they really weren't even being encouraged to do so. So for a lot of people, it was really difficult. They might not want to talk on the phone or text, or they might just be too overwhelmed with everything going on to reach out to their friends. So a lot of people really struggled with that. 52% of participants have had trouble concentrating on school or other daily activities often or all the time since the pandemic began. So again, the pandemic has caused a lot of stress, and schooling from home and working from home has been really challenging for a lot of people. It's hard to separate your home life from your work life when your work life is at your home life. So I think that was a struggle for a lot of people as well, especially if they have other things going on in their life that are really stressful. The differences in findings, 3% of participants said that they felt more motivated since the pandemic began, which was surprising to me, but I mean, good for those people. Maybe they just prefer to work from home or have really had the extra time to be able to do more and be more motivated. 6% said they felt no stress, and 9% said they felt rarely stressed about finances, which again was a little bit of a surprise to me, but there was the generous pandemic unemployment, so maybe that helped for some people, or others maybe just didn't lose their job because they were essential workers, so they didn't really feel the stress of that. 10% never or rarely found it challenging to stay in contact with friends, which I think it can be helpful when you have a lot of friends like at your workplace, especially if you were actually going in person throughout the pandemic, because then you were getting that socialization aspect that a lot of people were missing out on. Underlying causes of findings. So I'm thinking that the job losses could have been causing a lot of financial stress. This could cause students to worry about tuition and books and rent and car payments, insurance, phone payments, and other financial responsibilities they might have if they were losing their jobs or having their hours cut. Working from home and remote schooling, again, causes a lot of stress for people. It's hard to concentrate when you're in your own space. It's supposed to be like your space where you can relax. And people may not have the space for offices or dedicated study areas. They might have just one room, like their dorm room, or they might have a small apartment and there's not really a lot of space, or they could have roommates. So there wasn't anywhere to really dedicate to studying, which can be a challenge when you're trying to really focus in your home environment. People may have also been extra stressed if they're concerned about their health or the health of their loved ones, which definitely was a big concern for many people throughout the pandemic, and it still is for a lot of people. And it's been harder to make and maintain friends when you're physically unable to see one another as a result of the stay-at-home orders throughout the pandemic. So implications for social work practice. For the micro level, which is working with individuals, social workers can provide individual counseling to help students manage their stress right now. They can also connect students to community resources to relieve some of the burdens that they might be feeling, such as financial supports, social opportunities, even if it's just like a video chat. Tutors can be really helpful for the students that are struggling with working from home. Meso level social workers can work with schools to develop a curriculum around mental health, self-care, and stress management, which is prominent all of the time for students, not just college students, but elementary, middle, and high schoolers as well. But I think it's really important right now throughout the pandemic. And meso social workers can also hold groups, possibly through Zoom if they're not allowed in person, to help college students cope with the pandemic. Macro social workers could advocate for free behavioral health care for all students, which I personally think should be a thing all the time, but especially under the uncertain circumstances that we've been facing the past year and a couple months. Limitations from my study. It was a fairly small sample size. There was only 67 participants. So this isn't necessarily generalizable to larger populations. All of my participants also attended Anna Maria College, so you can't generalize it for every single college because it's only this one school. Non-probability sampling means there may have been some sample bias and the sample might not have been super diverse. I think that I could have had a more diverse population, especially with like age, gender, employment status, and marital status, which I noticed were not very different for a lot of my results. Convenience sampling, available participants may not have represented the whole population. I think that when you're depressed or really, really stressed or overwhelmed, it can be hard to even find a minute to take a survey. So those people may not have responded. So the results could be affected by that. It was a quantitative study, so there was no space for students to respond on answers. It was just like a yes, no, or a 1 through 5 rating. So we didn't really get to hear their experiences. The survey was fairly brief. It was 14 questions, which there are benefits to that. I think people are more likely to respond when they see that it's a quick survey that's only going to take them a minute or two versus a longer survey that you might get more information, but it takes a longer time and less participants may be interested. And other factors that you couldn't really measure could include testing positive for COVID-19, losing a loved one, or other, like, especially stressful situations that people have felt throughout the past year as well. And then random error was also possible. For example, somebody having like the best day of their life answered this survey, they may have been more positive and said they felt less stress overall, versus somebody who's having like the worst day ever and they're really struggling. They may have answered with more negative responses and felt more stressed and overwhelmed that day. So this could impact the results as a whole. Recommendations for future research. So I would recommend a larger sample size and more diverse. I would like to see a study that includes students from multiple colleges throughout the country and maybe even from other countries as well to see how the pandemic has affected them. Space for participants to add comments and expand on answers would be really helpful. So maybe a mixed method or qualitative study would be useful. And conducting research at multiple time periods, perhaps with the same individuals. This would help us with determining the long-term effects and just gauge how people are coping throughout the pandemic and after the pandemic is over. And these are my references. So thank you all for viewing my PowerPoint. And if you have any questions, I would be happy to answer them. Thank you.